You are always wondering and asking why you lose pregnancy. Why doesn't this baby inside of me grow to full term? Why do I have to lose this baby? And doctors tell me that no, the baby is not developing, it's just a clot of blood. It is stagnant, the growth is not happening. So they have to remove the baby or give you an injection or put a drip on you, then the pregnancy is flushed out. Babies are formed with sperm and egg. A healthy sperm and a healthy egg is supposed to form a baby. Usually, pregnancies do happen even though the sperm is not of the best quality or the egg is not of the best quality. What is available in the sperm and the egg that makes a baby become whole is the chromosomes. When a sperm is having a defect or an egg is having a defect, you cannot see it with your eyes, neither can your doctors see it with their eyes, nor under the microscope. Usually, your doctor uses your hormone function, the hormone ranges as it is produced in a test result to determine whether you have enough eggs in your ovaries or not, and of what quality those eggs could be. For the sperm, they analyze the sperm depending on the standard ranges they are supposed to see in a particular hormone or the other to determine if the sperm's motility, mobility, and morphology is of the right standard. Now, after your doctor might have tested and tell you that your sperm quality is good, your egg quality is good, you could go home and would conceive a baby 3, 4, 5, or 3 years later, or 5, 4 months later. What you need to know is that the sperm and the egg are not constant factors. Your egg reserve can change or your egg quality can change depending on the particular egg you release in that particular month, depending on the quality of your hormones function. The same applies to the sperm. Whether the man's hormones are doing well in terms of nutrition and daily lifestyle, the man can have a change in the quality of the sperm within the next 90 days. Now, if you and your partner meet and then you have a sperm that is not of the highest quality and an egg that is not of the highest quality, let's say that the sperm is supposed to be of a 10 and it is of 7, and the egg is supposed to be of a 10 and it is of a 6, you could make a baby. What happens is that there is a defect in that quality of sperm and then the egg. A baby can grow in the uterus depending on the support that combination of sperm and egg is receiving from the woman's body's hormones function at the early stages of the pregnancy. Now, notwithstanding, even a healthy sperm and a healthy egg can form a healthy baby from the onset, but the growth and the development of that fetus depends on what is happening in the woman's body in relation with her hormones. When your hormones, especially the hormone that supports pregnancy in the early stages, which is the progesterone, which is also supported by other minor hormones, are not receiving the right nutrition or are not produced in the exact quantities as required by your body during the early stages of your pregnancy, or within your pregnancy 5 6 months, or even to the latter stages you have a hormone drop, you can end up having a miscarriage. Even though science has not proven what and why there is always a miscarriage, there are several factors that are considered to lead to miscarriage in a woman in the first trimester, second, or the third trimester. Miscarriage can still happen. Here are 5 factors that can cause miscarriage in a woman. The first one I have said is unhealthy egg or an unhealthy sperm. Okay? Certain lifestyle conditions like excess drinking of alcohol or smoking can also lead to miscarriage. Okay, certain lifestyle conditions of the woman, maybe if the woman is going through excess stress, she can also experience miscarriage due to that. It is a factor. I'm not saying that is the reason why you lost that last pregnancy. When you lose a pregnancy, you are not supposed to play a blame game or a guilt game on yourself or a partner. Take note of that. Excessive intake of carbonated drinks and also soft drinks or some kind of medications can also lead to miscarriage. That is if your body does not like those particular contents. I'm not saying everybody who is pregnant may take excess carbonated drinks and will lose pregnancy, but depending on each individual's body, be careful of what kind of medications and what kind of drinks you are taking, especially in the early stages of your pregnancy. Also, if you have been taking a particular medication, especially those people who have poor hormone function or have low ovarian reserve and were on treatment already, if you go about to have a pregnancy and then stop taking those medications, that could also lead to a miscarriage. Why? Because the support your body was receiving from those medications to help you produce good hormones to grow that egg, that support is no longer coming. To not have a pregnancy end up in miscarriage, it is always important to go through a fertility boost preparation before you start trying to get pregnant. A lot of the time, you do not do this. Couples don't do this. We get married, we get on, and we get pregnant. This is also a reason why, even though most babies end up being born, they are born with birth defects, defects in the brain, defects in the heart, hole in heart, and the other things. Now, if you are trying to get pregnant or you would want to get pregnant in the next 3 4 months, what should you do? First, take a look at your diet. It is important. Your hormones get nutrition from whatever you eat daily. What you ingest daily will produce the outcome of what your body becomes in the next few months. Take a look at what you are eating. Number two, invest in a coach, somebody that can hold your hands and help you to understand the root cause of maybe your inability to get pregnant now, or help you set a strategic plan for you to go through a preparation at least 3 months or 6 months before you start out to get pregnant. After your fertility boost treatment or visiting the doctor to check on your fertility, do not sit down. Keep rejuvenating. Keep making what you did for you to be able to enjoy good health and a good fertile health now. Keep repeating. Keep doing it as a lifestyle until you are done making your desired baby. Subscribe to my channel. I am Belinda, your fertility and wellness coach. And in case you need a professional help to help you navigate your conception journey so that you can easily make babies from the comfort of your home, send me a message and enroll for my one-on-one coaching program on improved nutrition and lifestyle management from the comfort of your home to understand your body better, to know how to eat for your body, to know how to optimize nutrition for your hormones, and how to also continue that rejuvenation process until you are done making your babies. Remember, believe, act, become. You are meant to be a parent without struggling, having to lose your health, your life, and your wealth in the process.